Hello, this is Megan Scott, lead author of the article entitled Neurocognitive Correlates of Attention Deficit Hyperactivity Disorder Symptoms in Children Born at Extremely Low Gestational Age. The data analyzed in this paper was collected as part of the Extremely Low Gestational Age Newborn Study, or ELGAN. ELGAN is a multi-site prospective study of the risk of structural and functional neurologic disorders in extremely preterm infants. As part of the initial phase of this study, 1,506 infants born before 28 weeks gestational age were enrolled between the years of 2002 and 2004. The data focused on in this paper was collected at age 10 as part of a follow-up assessment in which 889 children returned to complete assessments of cognition, executive function, behavior, and academic achievement. Extremely low gestational age, or extreme prematurity, refers to children born before 28 weeks gestational age. This is a particularly important population to study as medical advances have improved the survival rates of children in the extremely low gestational age category, or the lowest end of the prematurity spectrum. Prior research has indicated that compared to children born at term, this group is at higher risk for a number of negative outcomes, including neurosensory disorders, global intellectual disability, as well as a profile of specific areas of neuropsychological deficits, including difficulties in attention, executive function, visual, spatial, and perceptual analysis abilities, visual motor skills, memory, and academic achievement. For this study, we were interested in better understanding the association between extremely low gestational age and rates of attention deficit hyperactivity disorder symptoms. There have been consistent findings in the literature that indicate that children with a history of extreme prematurity are at significantly higher risk for attention problems and diagnoses of ADHD compared to the general population or term controls. These difficulties have been identified in early childhood, with significantly higher rates of ADHD being identified as early as school entry or the age of 5 or 6. While the findings regarding higher rates of ADHD symptoms have been consistent in the literature, little is known about the neurocognitive deficits that accompany ADHD symptoms in the extremely preterm population. The focus of this particular paper is to better understand the neurocognitive correlates of ADHD symptoms in children with a history of extreme prematurity. In order to assess the presence of ADHD symptoms, parents and teachers were asked to complete the Child Symptom Inventory 4. In addition, parents were asked to provide information regarding whether or not a physician had provided a prior diagnosis of ADHD. Children were asked to complete a number of standardized assessments, including assessments of cognition, attention and executive function, and academic achievement. In this paper, we analyzed the data from 871 participants, from which we received CSI-4 reports from parents. Our findings indicated that ELGANs who screened positive for ADHD symptoms were at higher risk for global cognitive deficits and specific areas of neurocognitive deficit, including deficits in executive functioning, in the areas of working memory, inhibition, and cognitive flexibility, as well as deficits in visual motor skills. In addition, ELGANs who screened positive for ADHD symptoms were at significantly higher risk for poor academic achievement on standardized assessment measures as compared to ELGANs who did not demonstrate significant ADHD symptoms. These associations were weaker when the sample was limited to those with IQ scores that fell within normal limits. However, many of the associations remained significant. In conclusion, our findings indicate that the neurocognitive correlates of ADHD symptoms in extremely premature children place them at much and highlight the need for early identification of an intervention to limit adverse consequences in this population.